This is a role play developed as part of the course curriculum for Manage TB, an online course for doctors. The participants have enacted the roles given to them. The case discussed does not refer to any existing patient but has been developed as part of the course curriculum. The investigations such as X-rays and lab reports used in this case scenario belongs to patients treated at National Institute for Research in Tuberculosis, Chennai. Their identity have been anonymized.
A very good morning to you, sir.
Good morning, Dr. L.
Sir, I have a case to be discussed with you.
Yeah, go ahead.
And sir, there is a 35-year-old gentleman who is working in an IT company. Came with the history of a cough for past 20 days.
Okay.
And a fever for past 1 week. And also there is loss of appetite and loss of weight for past 2 months.
Okay. So, what are the tests will you order for this patient?
Sir, before that I have had a detailed examination and also I obtained a detailed history.
Okay.
I asked about the nature of cough, type of sputum and the antibiotics taken by him, and I have also inquired about any past anti-tuberculosis treatment. But he denied the history.
Well.
He also did not have any exposure with any TB patient in his locality or in his workplace.
Okay.
The patient is not reactive to HIV and he is not on any immunosuppressive agents like steroids, and there is no history suggestive of diabetes and malignancy. I also asked the history of smoking. I also done a systemic and general examination thoroughly.
Okay. Then what are the additional investigations will you order in this patient for diagnosis?
Since this patient satisfies the criteria for presumptive pulmonary TB, so I will order for 2 sputum smear for AFB, which should be taken in 1 or 2 consecutive days, and 1 sputum for gene-expert MTB rifampicin. I also order for chest X-ray PAV.
Good. You have really mentioned about most relevant tests for diagnosis in pulmonary tuberculosis. What about serology, blood serology? Would you order blood serology in this patient?
No sir, definitely not. I will not order because as per the Government of India notification 433E dated 7th June 2012, it says that no commercially serological test to diagnose TB is should not be done. So I will not go for the commercially available serological test.
I am very glad that you are aware of this, and would you be able to diagnose pulmonary tuberculosis with the help of just chest X-ray?
Sir, chest X-ray is not a confirmatory test. It is only a complementary test because the abnormal shadow is not specific for pulmonary TB.
What do you think about the role of CT chest in this patient for diagnosing pulmonary tuberculosis?
Sir, if the sputum smear for AFB is negative, and or if the sputum gene-expert MTB rifampicin is negative and chest X-ray found to be normal, then we can take the help of CT in eliciting the early changes, and the CT scan also helps in ruling out the pulmonary pathologies.
Okay, then what is the confirmatory test for pulmonary tuberculosis diagnosis?
Confirmatory test is smear positive sputum for AFB and or sputum gene-expert MTB rifampicin.
Okay, culture positive also, but it will come later on.
Yes.
Okay,
Definitely.
so bacteriologically positive is You will
sir.
take it as a
Exactly, sir.
confirmatory test
Exactly, sir.
in the diagnosis of pulmonary tuberculosis. Well done. Could you just summarize the important points out of our case discussion?
Definitely, sir. Positive sputum smear for AFB and or positive expert MTB rifampicin confirms pulmonary TB diagnosis. Serological tests are not recommended for the diagnosis of TB. Chest X-ray is only a complementary diagnostic tool in pulmonary TB.